Good day, sir. I'm here for the procedure of teaching client to use the incentive spirometer. So first, our goal is the patient accurately demonstrate the procedure for using the spirometer. Then, our equipment is incentive spirometer. So, first is for the implementation, review the chart for any health problems that would affect or the client's oxygenation status. Then, bring the necessary equipment to the bedside stand or overbed table. Then, perform hand hygiene and put on PPE if indicated. Once the patient has communicable disease, put on PPE. Then, identify the patient. There are ways on identifying the patient. First is look for the risk tag, then ask the patient what's name. Then, close the curtains around bed for privacy and close the door to the room if possible, if it is patient's will. Then explain what you're going to do and why it is necessary and how the patient can cooperate. Then assist the patient to an upright or semi-power's position and remove dentures if they fit poorly and assess the patient's level of pain from 1 to 10. Rate 1 to 10, then administer pain medication as prescribed if needed. Then demonstrate how to steady the device with one hand and hold the mouthpiece with the other hand. If the patient cannot use hands, assist the patient with the incentive spirometer. Then instruct the patient to exhale normally and then place lips securely around the mouthpiece. Then instruct the patient to inhale slowly as deeply as possible through the mouthpiece without using the nose. Then, when the patient cannot inhale anymore, the patient should hold his or her breath on count to 3. Check position of gauge to determine progress and level attained. And then, if patient begins to cough, splint an abdominal or chest incision. Then, instruct the patient to remove lips from the mouthpiece and exhale. If patient becomes lightheaded during the process, tell him or her to stop and take a few normal breaths before resuming incentive spirometer. Then encourage patient to perform incentive spirometer 5 to 10 minutes. Encourage patient to perform incentive spirometer 5 to 10 times every 1 to 2 hours if possible. Then clean the mouthpiece with water and let it dry. Do not use alcohol because pwedeng lumasa yung alcohol. If remove PPE if used, perform hand hygiene, then document. When you already identify the client, provide privacy and introduce yourself and tell the client what you're going to do, why it is necessary, and how the patient cooperate with you. So, in this demonstration, we are going to use the incentive spirometer. I don't have a real spirometer because it's quite expensive. So, I use this printed one. We're going to teach our patient how to use this. Our patient has a problem in lungs, and he will going to check if his breath is good or not. Then instruct the patient to hold this and the mouthpiece. So first, you are going to instruct your patient to breathe in and breathe out. Inhale, exhale. Then after this, you are going to put the mouthpiece on your mouth. And then once you put the mouthpiece in your mouth, and then once you put the mouthpiece in your mouth, check for the first ball. This ball contains 600 cc and this is 900 cc and 1200 cc. Then once you breathe in, the balls goes up. Next is this, and then last. And then minsan po kasi hindi isa lang yung umaangat. Ngayon, pag isa lang yung umaangat, every hour, i-practice po nila ito. So, instruct po yung client na i-practice ito kung paano gagawin para ma-improve yung ma-reach natin itong goal na to. This is how you use incentive spirometer. Then after that, document it. That's all. Thank you.